More countries are now shifting toward a state called normalcy and learning to live with the virus. We know that safe and effective vaccines have been developed, and we also have better understanding of how to treat people sickened by the virus in a way to prevent them from dying from the complications of the disease. However, 2 years after the pandemic began, a lot of questions still remain, and among the many uncertainties are the long term risk and complications post COVID infections. But unlike before, we now know a lot more about how to keep COVID infection under control. Since alert level 1 in the country and going to alert level 0, the markets are already crowded again and traffic is jamming the roads. Malls are again packed with people, including restaurants. More and more restrictions like curfew have already been lifted. But it isn't quite how things were before the COVID-19 pandemic, since mask mandates still exist. But with infections steadily declining, life in South Asia is returning to a sense of normalcy. Countries have slowly been opening up. While experts agree that opening up is the right move amid falling case numbers, they caution that optimism should be tempered with lessons from the past 2 years. How then should we live with the virus? Let's watch this. Yes, we're opening up, but please continue to be vigilant because COVID is still around us. I am very cautious and I prefer to be on the safe and safer side. Remember, the virus mainly spreads through the air when an infected person exhales, talks, coughs, or sneezes. It is for this reason that we strongly encourage that we continue to use mask and to gather only in well ventilated spaces and no longer focusing on advices to wipe down surfaces as they did early on. Along the years of the pandemic, while vaccinations going along very well worldwide, treatment has also evolved for people who get sick or need to be hospitalized. We now have better options in terms of antivirals, such as newer pills from Pfizer and Merck. As a result, governments across the world are now desperately trying to return to normal and live with COVID as an endemic disease akin to that of flu. But in reality, COVID is never similar to flu in terms of infections and severity and long term outcomes. In the US, for example, COVID 19 deaths are still 10 times higher than those from the flu. And going into March of 2022, the US is still experiencing 35,000 hospitalizations per day and 12,000 deaths per week from COVID 19 infection. And only greater killers in the US nowadays are heart disease and cancer. This dreaded data, therefore, is a far cry from the usual weekly 1,000 deaths from flu or respiratory illnesses caused by RSV. While it may be that the worst of COVID 19 may be behind us and that the world is carefully approaching normalcy, two factors have become critical as the world exits the pandemic: the COVID 19 fatigue and the entry of new variants. It is therefore best that our government should invest more on monitoring and preparing for future COVID threats, demands more investment be made in the manufacturing of better and safer antiviral pills. We know that in the new normal, while many of the precautionary measures, such as masking, might be relaxed by health officials in some areas, however, it could be reinstated anytime if surges of COVID 19 cases occur. It is also expected that during periods of high transmission, we may see some of these restrictions return, like wearing masks, depending on the local prevalence and strains that are around and the vulnerability of the people who are in there. Hospitals will definitely have a lower threshold for recommending or even requiring masks during surges in the future. But what we expect is that, if at all, these surges will be shorter and less frequent than we've seen in the past 2 years, where it's really been a pandemic. Yes, vaccines will definitely continue to be our best defense in the new normal for us against future surges of COVID variants. However, we actually need more data to support to whom it should be focused on and how often should booster shots be given. For now, we know that an annual COVID-19 vaccine booster might not be needed for all, but only for a few, and that the majority might only need a booster dose every 3 to 4 years, especially if you are young and healthy and free from any comorbidity. Therefore, my assumption is that with the new normal, let's enjoy the new way of living, continue to keep safe, continue to keep your mask on for now, especially in public places with poor ventilation. I still continue and I still appeal that it is still safer and still best to be on the safe side, not to get infected, even if your symptoms will be mild, since long COVID syndrome can still haunt you. It is therefore best to avoid getting infected and therefore best to still practice the safety protocols. With that, this is Dr. Jerry Tan. See you again soon.